If you're getting ready to retire or about to turn 65, this may be one of the most important videos you watch before enrolling in Medicare. Often, new retirees turning 65 wait until the last minute to learn about Medicare, which can lead to confusion, costly mistakes, and unnecessary stress. My name is Jeremy Dodd. I'm a certified financial planner, and I currently manage over $99 million in assets for clients who are entering the same stage of life that you are. Over the years, I've seen people make decisions that cost them thousands of dollars, lock them into higher Medicare premiums for life, or leave them with unexpected medical bills simply because they didn't know the rules. So today, I want to walk you through the 7 biggest Medicare mistakes new retirees make, and more importantly, how you can avoid them yourself. Let's jump right in. Mistake number 1, missing your initial enrollment period. It's probably the most expensive mistake I see. When you first become eligible for Medicare, you have what's called your initial enrollment period, or IEP. And this is a 7-month window. It begins 3 months before your 65th birthday, includes your birthday month, and continues for 3 months afterward. And that sounds like plenty of time, but many people either don't realize the clock is ticking or they assume they can enroll whenever they want. Don't do this. If you miss that enrollment window and you don't have what's considered creditable coverage from a large employer, Medicare doesn't simply let you sign up without consequences. Instead, they can assess a permanent Part B penalty. That penalty is 10% for every full 12-month period you delayed enrolling. Now think about that. This isn't a one-time fee. It's added to your Medicare Part B premium every single year for as long as you have Medicare, and it doesn't stop there. Prescription drug coverage has its own penalty. If you go 63 days or more without qualifying drug coverage, Medicare can charge you a 1% monthly Part D penalty, which also continues moving forward. These penalties are completely avoidable. The key is understanding your enrollment timeline before you turn 65 instead of trying to figure everything out afterward. Mistake number 2, assuming your small employer health plan is primary. Here's a situation that catches many people off guard. Maybe you're turning 65, but you're still working. You think, I already have health insurance through my employer, so I don't need Medicare yet. Sometimes that's true, and sometimes it isn't. The size of your employer matters. If your employer has 19 or fewer employees, Medicare is generally considered the primary payer. That means Medicare is expected to pay first. Your employer plan pays second. Don't do this. If you decide not to enroll in Part B because you assume your employer coverage is enough, your employer's insurance may refuse to pay the portion that Medicare should have covered. That could leave you responsible for a significant amount of medical expenses. So imagine thinking you're fully insured, only to discover after a hospital visit that you're responsible for the bills because Medicare should have been the primary coverage. That's an expensive lesson to learn. Before delaying Medicare because you're still working, make sure you understand how your employer coverage coordinates with Medicare. Mistake number 3, continuing to contribute to an HSA after enrolling in Medicare. Health savings accounts are a fantastic tools for many people, but once Medicare enters the picture, the rules change. Once you're enrolled in any part of Medicare, you're no longer allowed to contribute to your HSA. Many retirees don't realize this, and here's where it becomes even more complicated. If you delay Medicare beyond age 65 and enroll later, Medicare Part A is often backdated by 6 months. Now that's important because if you're continuing to contribute to your HSA during that backdated period, you may create tax issues. Don't do this. To avoid tax penalties, you should stop making HSA contributions at least 6 months before applying for Medicare. This isn't something most people hear about until after it's already happened. A simple planning conversation ahead of time can help you avoid unnecessary tax headaches. Mistake number 4, believing Medicare pays for long-term care. This may be one of the biggest misconceptions in retirement planning. Many people believe Medicare will take care of them if they ever need long-term care. Unfortunately, that's simply not how Medicare works. So when most people think about long-term care, they're talking about ongoing assistance with everyday activities like bathing, dressing, eating, or custodial care. Don't do this. Medicare does not pay for long-term custodial care. Instead, Medicare only covers skilled nursing care under certain conditions, and even then, it's generally limited to up to 100 days. after a qualifying hospital stay. That's a huge difference. If someone ultimately needs long-term care beyond that skilled nursing benefit, those expenses are generally paid out of pocket or through private long-term care insurance, and those costs can be staggering. A private room in a long-term care facility can exceed $130,000 a year, and that's why I often refer to this one as one of retirement's biggest financial risks. It's not because people intentionally ignore it, it's because many people assume Medicare handles it. Planning for this possibility before you need it, it is much easier than trying to solve it during a health crisis. Mistake number 5, accidentally triggering IRMAA surcharges. Let's talk about something many retirees have never heard of. It's called IRMAA. IRMAA stands for Income-Related Monthly Adjustment Amount. Here's what catches people by surprise. Medicare doesn't simply look at your current income. Instead, it generally uses a 2-year look back based on your tax return to determine your Medicare premiums. That means decisions you make today can affect what you pay for Medicare later. Don't do this. Large one-time income events can increase your Medicare premiums. For example, selling a home or a property that creates large capital gains, completing a large Roth conversion, or taking a significant IRA withdrawal to pay for something like a family wedding. Those one-time income spikes can trigger IRMAA surcharges that increase both your Part B and Part D premiums. Many retirees only focus on the tax consequences of these financial decisions, and they don't realize there may also be Medicare premium consequences. It's another reason why retirement planning should look at the entire picture, not just one piece. Mistake number 6, choosing a Medigap plan based only on today's price. Everyone likes saving money, so when people shop for Medigap plans, it's natural to compare monthly premiums. But focusing only on today's lowest price can become expensive later. So one of the most overlooked details is how the policy is rated. There are different rating methods. For example, an attained age policy often starts with a lower premium when you're 65, and that sounds great initially, but those premiums increase as you get older. Don't do this. The least expensive option today can eventually become the most expensive option decades later. Instead, understand whether you're looking at an attained age policy, issue age, or community rated plan. Issue age and community rated plans generally provide more predictable long-term pricing. This isn't about saying one rating method is always better than another. It's simply about understanding how today's decision can affect your retirement budget years down the road. Mistake number 7, thinking your annual wellness visit is the same as a physical. This is one that surprises a lot of new Medicare beneficiaries. Someone schedules what they believe is their free annual physical. Then a bill shows up. They immediately think Medicare made a mistake, and usually Medicare didn't. But here's why. Medicare covers what's called an annual wellness visit. This visit focuses on prevention, health planning, and helping identify future health risks. It's not the same thing as a traditional head-to-toe physical exam. Don't do this. Another situation that creates unexpected bills is bringing up a brand new medical concern during that wellness visit. Maybe your back's been hurting. Maybe your knee's been bothering you. If your physician evaluates that new medical issue during what was scheduled as a wellness visit, they may bill it as a separate problem-focused visit. That additional service can result in a copay or deductible. Many retirees are surprised because they assumed everything during that appointment would be free. Understanding the difference beforehand helps you know what to expect and helps you avoid those surprise bills afterwards. The good news is that every mistake we've talked about today is avoidable. The challenge is simply knowing the rules before making important Medicare decisions. Whether it's understanding your enrollment period, coordinating employer coverage, stopping HSA contributions at the right time, planning for long-term care, avoiding IRMAA surcharges, choosing the right Medigap pricing structure, or understanding what Medicare actually covers during your wellness visit, each one of these decisions can have long-term financial consequences. If you're approaching Medicare eligibility or helping a family member who is, taking the time to understand these topics now can save you money, reduce stress, and help you make a more informed decision. If you found this video helpful, make sure to like the video, subscribe to our channel, and share it with someone who's approaching retirement. It may save them from making one of these costly mistakes. Thanks for watching, and we'll see you in the next video.